I have the pleasure today of introducing Dr. Patrick Palmieri, who is a global health expert from Peru. Dr. Palmieri co-led the formation of the largest vertical health delivery system in Peru and is an associate editor of 4 leading medical journals. He was also one of the main drivers behind the Transparency Initiative in Peru's pandemic. Peru has the highest number of deaths per capita in the world and is dealing with the deadly Lambda variant as the major COVID strain which is infecting its population. So at this time, I'd like to turn the floor over to Dr. Palmieri and to have him present about COVID-19 in Peru.
So one of the things I would like to do is I'd like to mention to you that I'm gonna share the reality of what we're experiencing in Peru, the lived experience, rather than probably what you're seeing on the news and in the newspapers in terms of our situation. Here's some information about me. This is the first healthcare accreditation ever in Peru that I was responsible for. So I wanted to let you all know that I've been working here since 2009, and I have a lot of experience in the public and private health system in Peru, as well as all over Latin America. So I just wanted to give you a little bit of background about why I know something about healthcare in Peru. I have no conflicts of interest to disclose, which I wish I had some because I'd be a little bit wealthier probably, but there are none to disclose. So what I want to start with is I do a lot of work in the provincias of Peru, which are kind of like the rural areas, like going to Arkansas or Alabama, that type of area in terms of cities, Gadsden, Alabama, for example. And there's a regional hospital in Lambayeque, and Chiclayo is the major city within this province. This is a beautiful looking hospital, but on the inside, it's an awful wreck because we don't build things here without corruption. And so the supplies and the materials they use don't last very well. And this building in particular is rusting and disintegrating. In this hospital, there was a very strange issue that occurred last year where in English, what this slide tells us is that the number of deaths per 100,000 people was substantially higher than all over the country. And we're like, wow, this is strange. I know this province very well. Why would this province have this huge outlier? It doesn't make sense. But when you look at the issue more closely, you'll see that this is at the hospital, real pictures in the hospitals, ventilators not working because they can't be repaired because we purchased them many times without contracts for repairs and to keep them up to date. But when we investigated further, we found out that the problem is similar across the country. So the ventilator problems were not just causing this death rate. In the provinces, things are different. You can see here how we managed just with a couple of pictures. I think it tells a lot more than I can explain by words, but we were using paper bags, plastic bags as personal protective equipment. And people were literally just placed all over the hospital nooks and crannies because we had no place to put them. And this is from Lambayeque. Well, as we started digging into the problem, we realized that there was an oxygen shortage that was occurring throughout the country, but people weren't aware of it because individuals were not trying to buy oxygen. So in Peru, when the pandemic hit, we had 822 ICU beds. Probably of those ICU beds, 822, about 70% of them had a working ventilator. The government will tell you they all had a ventilator. That's true, but was it working or not is the second question that you need to ask. And about 637 hospital beds. That word hospital bed is kind of subjective because you can't think of these hospital beds like in the American mindset. Okay, so I just want to preface that. We had a problem with corruption in Peru where they made oxygen production a monopoly, essentially. And I know this because we were required to take out of our hospital that we had built the oxygen facility because there's a monopoly that was supported through regulations. And so what ended up happening in Peru, long story short, is oxygen prices were like $1,800 to $5,000 for each large cylinder to be refilled because there were no oxygen plants that could meet the capacity for demand. Interestingly enough, even ICU beds were without oxygen because of this problem. I want to put this into context for you. These are real pictures from Peru, and you can see people sleeping, literally waiting to refill their oxygen tanks because so many people were needing oxygen at home because there were no hospital beds and people were being managed that way. So this problem was kind of hidden and it emerged through all of this data being shared. And I'll go back to that other data that I shared with you in terms of why that's relevant. Why do I talk about these problems with the delivery and the oxygen in the beds? Well, this gastro-fiscal port COVID-19, what this is basically is the percent of our gross domestic product, okay, that's spent on COVID-related expenditures. I mean, expenditures for COVID. And you can see here as of May 10th of this year, Peru is leading in expenditures, but we're certainly not getting in return any sort of benefit from these expenditures. You can see here, for example, in this one picture in the top corner of the screen, that the masks that we were buying were defective. The ventilators we were buying from China were not specific for COVID type patients, or they didn't work when they arrived. So in Peru, the reason why this happened was because we have a history of corruption in our health system, and people use the health system to make expenditures for their own personal benefit. Politicians have companies, their friends have companies. And so this was a massive spending orgy during COVID-19. And this graphic that has recently been published by researchers demonstrates that, although the government's been wanting to kind of dismiss this reality. The situation became very real in Lima when prestigious hospitals, this hospital Regalate is like the prestigious public hospital in Peru, okay? When wives and husbands were dying because there were no ventilators at this prestigious hospital, people started to panic because now it wasn't a problem in the province. It became real for people in Lima. And the government couldn't continue to hide the extent of this problem because people were being impacted and you would see them on the news. This is just one of many news channels that I could have told, okay? This is a story of one of my students. This is in Spanish, but let me just tell you, she was told her father wasn't a priority because he was older. So he essentially died because he was not young enough to receive a ventilator. And this man is not very old, by the way. This is a picture of him a year before at graduation. She's one of my nursing students. And she wrote her little summary here. It says here that because he was an adult, an older adult mayor, he wasn't a priority for a ventilator. But yet the government was dismissive and saying, no, this is not happening in the country. So what I want to make you all aware of is that when we talk about misinformation and fake news, et cetera, in Peru, we have a huge catastrophe because the government doesn't tell the truth most of the time. They tell the political truth. And this is something that's really impacting our ability to recover from COVID and to manage COVID. I want to give you a little side story. The University of Michigan developed this really swift and neat ventilator that's been marketed now by Boston Scientific. We were given the plans, the blueprints, the complete blueprints by Boston Scientific and given permission. I had to sign a lot of contractual forms, but given permission to reproduce this ventilator, this emergency ventilator in Peru, okay? We started putting it together. The engineers started putting it together, and we had a working prototype that we were ready to put to work, okay? The cost of this ventilator is $480 to produce. It's simply an emergency ventilator, okay? Mechanical emergency ventilator. Well, let me just tell you, and I'm going to go through a long story, but they don't want this ventilator in Peru. They didn't want it because it didn't serve the corruption purpose of being able to buy ventilators at huge prices in order to meet the needs of the political hierarchy that makes a lot of money from the health sector. This is a real story. I mean, I've spoken directly to the minister about this project. Couldn't get support from my university to put this project into fruition, to make this happen. So I need you all to understand that corruption, political corruption, is a large part of what's happening in all of Latin America, not just Peru. But this is real stories. So then in Peru, I don't know if you all have heard about this, we had this death data error. Many of us researchers were looking at the data and saying, no, this is not what we're seeing in terms of death rates in the hospitals that we work with, okay? We're not seeing this data. This is not real. And you can see this is the deaths before the revision. Well, what ended up happening was many of us started going back to the death rolls, and we started looking. The last 5 years, every January, February, March, how many people died? And we started putting graphs together. And we were able to see that the government was seriously misrepresenting how many people were dying in hospitals. So much so that the BMJ had a story about this, because when we exposed the truth here, when the government said, because the new government came in, we think it's our duty to make public this updated information. The death toll tripled because of the hidden data. The Minister of Health said, what is being said is that the significant number of deaths were not classified as caused by COVID because we only listed people who were positively diagnostically tested, okay? Well, this is not what they were telling people in the country. These are the spins of politicians trying to explain why the previous government was responsible for hiding almost 2/3 of the total deaths. So I want to put this in perspective for folks in the United States, because this is almost unbelievable for me as an American who's also Peruvian living in Peru. Here's the data, the real data now, when they made the adjustment. We went to having double the deaths per 100,000 people in one day of Brazil, Italy, the UK, the United States, Mexico. So this is a significant problem in all developing countries of Latin America. Truthful data. This is one of the reasons why research is so important in this region, is because we have to have true data. So then we move into another issue related to researchers, which is Vacunagate. I don't know if you all have heard of this, Vacunagate. Well, in Peru, the rich and the powerful found a way to get vaccines before everybody else from a Chinese company. How did they do this? Well, they did it through accessing vaccines that were supposed to be used for a clinical trial. These vaccines were brought into the country under the auspices of a clinical trial. They were illegal to use in any other way, but a group of researchers at one of our prominent universities found a way to engage in substantial misconduct that resulted in 487 people receiving vaccines that shouldn't have received them. And one of the largest news in this country called this the vaccine festival. When it was exposed, people were trying to keep their names out of the media, but they finally were forced to expose all of the people that received these vaccines. And one of them was our former president, who was impeached, Martin Vizcarra. So why do I talk about this? This is just something you can look at later in my slides, because I did an interview with the Lancet in terms of the problem we face in Peru is that the permanent political class uses their influence and power for the benefit of their families and friends, while other people manage an enormous bureaucracy. One of the things I'd like to leave you all with as I finish this presentation in a couple minutes is the bureaucracies are created to either facilitate things or to prevent things. There's always niches and crannies in the bureaucracy. We have lots of rules and regulations, and they're designed to help people or punish people. And I've personally experienced this because I'm punished all the time. I get audited more than you can imagine by our tax authority, even though everything I do is officially through the books electronically, because I get punished for speaking about the things that happen in this country. So there's no accountability. So for this Vacunagate, where all these vaccines were given to these powerful people, okay, this physician who was in charge of it gave vaccines to the chancellor, the vice chancellor, the deans, like of these universities. They refuse to resign. They think that this is no big deal. This is one of our privileges, okay? We're entitled to this. The sad part is, like every other scandal in this country, although there was a substantial research misconduct and breaches in the protocol, they were giving 3 vaccinations to people, which were not in the protocol. They just did it because they were curious. They've received only a 1-year suspension from their university and a 6-month suspension and a warning. One of these researchers, Dr. Hector Hugo Garcia, works a lot with Johns Hopkins, and he is actually a funded researcher by the NIH in the United States. The United States has not revoked his grants. They're still active as of 2021. And I know there have been complaints filed with the NIH about this case. So one of the things I want everybody to look at here is that we have some major problems with the way vaccines are developed, with the way vaccines are tested in developing countries, and with the way we even adjudicate misbehavior. In this particular case, even members of the ethics committee at the National Institute of Health were implicated in family members receiving vaccines. So these are things as an American, it's hard for me to believe these can happen. I'm speaking about this NIH case because I want all of you to understand the NIH is not doing their business in terms of governing the resources that they give to people in other countries when they commit misconduct, when they commit bad cases of ethical misconduct. So this is very important. Next, I want to get to the good part of things. Peru does vaccination super well. You can see here the nurses, I mean, they're taking donkeys and bridges, makeshift bridges, and they're walking across rivers. And I mean, we vaccinate people at their homes, wherever they are, okay? We move vaccines through the country rapidly. This is one of the things I want to impress upon you because I'm surprised the US, I'm watching these stories, I'm like, why are people against nurses bringing vaccines to people's houses? This is foreign for me because in Peru, public health is something that we do in the community, right? And we bring vaccines to the people, literally in the middle of nowhere. So I think the United States can learn something from Peru, other than the fact that we have a lot of corruption. I think they can learn fundamental, basic public health duties that we've probably forgotten about, which would be very effective for our population. And in this case, like I said before, I mean, this is amazing work that we do here. Now, why is this important? We've been buying vaccines from all different providers because we have to deal with the hoarding effect of powerful developed countries of the world, where they just buy as many vaccines as they can. They do this for us, by the way, for influenza. Many times we're waiting for countries like the United States and Canada and England to release their vaccines that they've hoarded so that we can have some when it's time for our influenza season. So one of the things I want you to see is we've purchased from all these different companies. We just purchased 20 million doses from the Russians. So we have enough vaccines on contract. But the thing I also want to emphasize to you is that our vaccination program started late. And why? Because our former president, who was impeached, was removed from office. He was trying to wheel and deal with Sinopharm, which is the Chinese company, to get their vaccines. And everybody's suspicious about why that was the case. The Pfizer contract was never executed, although it was prepared. And everybody knows this. So one of the other things I want you to understand is vaccines are big business for many governments out other than the developed countries because people are making money from the vaccines, okay? This is not something that's not for profit. There's huge profit, but it's done in these very suspicious manners. Here you'll see, this is from last night. I took these pictures of my camera because this data has not been even published yet. We started our vaccination campaign on February 9th. And at this point, we have about 4,100,000 people vaccinated out of the 28 million that we need to vaccinate. So we've vaccinated everybody from like 100 plus years old down to 50, and now we're entering the 40-year age category. We expect to have everybody vaccinated. I'm not sure if this is, I hope this will happen by the end of this year or the early part of next year. So we have the vaccines committed, so it's possible. But I want you to see how quickly we have worked to get vaccinations done in this country. I mean, I think we've done a substantially good job to vaccinate almost 4,100,000 people fully from February to July, sorry, Julio. So here's the last photo I want to show you. This is the Peruvian Nurses Association, the way they show this vaccination campaign, because they're very proud of the work that they do. I've given you some references in the end of this slide where you can look at other data from reputable sources like Nature, the BMJ, Lancet for information about Peru. These slides are fully available. I'm sure Kevin can send them out to anybody or if you want them. The article that I gave my interview with, and here's my contact information. I'll be happy to take any questions, but let me turn this back over to you, Kevin.
Okay, well, thank you very much. I'd like to start off on a question with the cases that you're seeing with the Lambda variant. Do you feel that the Lambda variant is more lethal than previous variants? And are you seeing breakthrough with vaccines? Are people who are vaccinated developing infections? And if so, are they severe ones?
Let me tell you what's going on here. And this is not scientific at this point because there's a lot of researchers looking at the issue. But let me tell you what I've heard from my colleagues in Chile because I've been in contact with them, and they're having more of a problem than we are with this variant. There's two things happening simultaneously right now. The first thing is there's a lot of arguments in various countries about the Chinese vaccines and their effectiveness with Delta and Lambda. Okay? I don't know whether or not these arguments, these scientific discussions are the truth or if they're not. But that's the main gist of the discussion. Our College of Medicine, the Colegio Médico, which is kind of like the American Medical Association, but like with the Board of Medicine attached to it, like you're required to be a member, they have petitioned the government to give Pfizer vaccines to their doctors because they're not convinced that the Chinese vaccines that all of the healthcare providers received are sufficient for Delta and Lambda. And there is a higher rate of physicians dying who are vaccinated. But again, there's more arguments about were they fully vaccinated, they received 1 dose or 2 doses. The other problem that we have to look at is there was a scandal in Latin America where people were getting jabbed the needle, but they weren't getting a vaccine because people were stealing them this way. Can you imagine? I just can't imagine. But when I went to get my vaccination 2 weeks ago, because I was finally eligible and I didn't do the unethical behavior of trying to get it through preference, they showed me they were drawing it up. I mean, it was a whole process because it was a lack of confidence in whether or not people were, and they had it on video, people getting literally air injections, okay? So I want to tell you this because I don't want you to think that, oh, what Patrick is saying is true. I want you to understand there's a lot of contamination about how we look at this issue. But I will tell you that the Chileans in particular, all of their vaccines came from China. And when you look at countries like Israel, they're having a little bit of higher rates, but their vaccines didn't come from China. And they have equal vaccination rates. So as a sensible scientist, I say to myself, something's not the same here, right? So we don't know how much Lambda is in Israel right now, for example, or Delta, because I've been looking for that data, and my friends tell me it's being accumulated. They're putting this data together. So I think we have to patiently wait to see what the data tells us. I will say to my colleagues in Chile have told me that the Lambda strain does have some serious changes that could make it more lethal. But we're not sure whether or not those changes, molecular changes, are going to be impactful on people who have been vaccinated and with which vaccines they have been vaccinated. But the people in Chile are more concerned about the Lambda than they are about the Delta variant, just to put the story into context.